We are really lucky to kick things off today with our president, Dipti Itchhaporia, who's going to come on up and kick things off talking about MI in women, why does it matter? Dr. Itchhaporia.
Thank you so much, Mike, and thank you so much to both of you for hosting this. I remember the first time that Roxana told me about the Lancet Commission. If you remember, we were in Saudi Arabia, and you were saying she was so excited about this, and so it's so nice to see kind of the evolution, and I love the idea of this being the year of, the awareness. I mean, because this is something that we're getting asked is, somebody asked me recently, well, because of all the campaigns with Go Red for Women and all of that, haven't we just increased our awareness? And the data was phenomenal to know that we're starting to see a decrease. And so we really need to do, as you guys said in the Lancet Commission, a redoubling of our efforts for this. So anyway, I wanted to say good afternoon to everybody. Thank you so much for the welcome, and I'm really thrilled to be here in DC for ACC 22 and joining you. I'm so honored that Drs. Roxana Moran and Birgit Vogel invited me for today's event. Myocardial infarction in women as part of the Lancet Cardiovascular Disease and Women Educational Series program. And as clinicians, we have to put a spotlight on heart health. Why? Well, because we know that, for starters, that cardiovascular disease is the #1 killer of women. And somehow that message is not getting out there the way that it should. And we know that more than 1 in 4 women die of cardiovascular disease, and that's more than the number of women that die of cancer, including breast cancer. And so that's also, and I think the little pink ribbons have gone a long way of really getting that message out. For some reason, we haven't been able to do the same. I think we've made a lot of strides, but I think we need to redouble down our efforts, like you said, Roxana. So we know there's greater morbidity and mortality in women post myocardial infarction as well as stroke. We know that women have sometimes atypical symptoms that can lead to delayed diagnosis and treatment. And we know that women are prescribed statins less often. We know that they're less likely to have under 90 minutes door-to-balloon time. I can go on, and these gaps in care can cost lives. And I think that the COVID pandemic, this time is so prime because the COVID pandemic has really underscored a lot of existing realities in our healthcare system, including how much health really matters, and the fact that health and the economy are linked, and the importance of achieving health equity to achieve good health for everyone, including women. And so when we talk about health, the healthcare disparities, it's not just for racial or socioeconomic, but even for gender issues that we're seeing. So in 2007, the Institute of Healthcare Improvement, launched what they call the triple aim, the concept of improved patient experience, better outcomes, and lower costs as key to healthcare transformation. And then they realized that they were not going to achieve this. Why? Because they forgot to put the clinician at the center of it. And when they added the clinician, that evolved into the quadruple aim. And then now I would say that we've evolved to the quintuple aim, which is putting health equity. That means that we have to look at all of the different populations that are underserved with various cardiovascular diseases, at least from a cardiovascular lens. And so I think that health equity is a key element and really necessary for improved patient care outcomes and really cost. So I think without understanding the social determinants of health, which drive 80%, 70% of healthcare outcomes, and without a clear path forward to solve health equity for everyone, including women, all attempts to really transform cardiovascular health is going to be futile. So I think achieving the quintuple aim is a worthy goal that ties to the ACC mission of transforming cardiovascular care and improving heart health. And I think the ACC, the Lancet Commission, all of you that have worked so hard for all this, this is a transformative time for us to really push this agenda because health equity has come to the forefront. We should use our NCDR registry data and other data sources to try to understand what the drivers are of cardiovascular health. I think we've also got to find ways to look at socio-demographic data, clinical data at the individual and the community level, and to better understand the distinct needs of the population that we serve. So I think we can play a really important role in helping combat bias. And I think this is a really important time when you think about one of the things that I've talked a lot about this year is And Mike, you and I talked about this digital transformation. And Martha, you had a great paper that talked about maybe removing some of the bias in terms of using AI, artificial intelligence, to remove the implicit bias when you're treating a female that may present to the emergency department with a myocardial infarction, because you remove that bias because now you have this AI technology that's augmenting what we think about. So I do think this is a really incredible time for all of this. So we definitely need to combat implicit bias amongst clinicians, with the goal of improving communication, engagement with patients, and ultimately transforming our patient experience and health outcomes. So if this is our focus, I think women will benefit, women will survive, I think women will thrive. And today, we'll get the deep dive on all things myocardial infarction in women and have a masterclass in addressing disparities in care and so much more. So today's agenda, I know, is jam-packed with sessions from brilliant clinicians who are doing incredible work to improve women's heart health around the globe. So thank you so much for having me, and I wish you, an incredible symposium to talk about all of this, and I'll be there with you to get the message out. Thank you.
Before she steps down, let's give Dr. Itchhaporia a round of applause for her great job in inclusion, diversity, and equity over the past year. Congratulations. Great job.
Thank you.
Thank you so much, Dr. Itchhaporia.
Thank you.
Thanks for coming.